Today I'm going to talk to you about the story of Alzheimer's disease. Do you think that your memory problems can be because of Alzheimer's disease? If you think that way, you're most likely wrong. And the whole idea that people have Alzheimer's disease actually is questionable. I'm going to explain to you the story of how we reached this point of thinking that anyone who has memory problems is an early stage of Alzheimer's disease. It's a fascinating story. You know, in 1700 BC, people knew that when you get to your 80s and 90s, you'll have memory problems. In fact, Pythagoras, the Greek philosopher, thought that when you get to old age, you act like children, which is actually kind of right, isn't it? Hippocrates agreed, and he thought that people develop memory loss and dementia in late life because there's an imbalance of fluids inside their body. And Aristotle thought it's your heart that controls your thinking, and the function of the brain is to cool your heart. But in any case, when you get to old age, your heart doesn't work well, and that's why your memory is not good. Now, in Middle Ages, there was an emphasis on religion, and it was thought that old people who developed dementia were cursed, and it's because they had sinned when they were younger, and this was the punishment for them to develop dementia. As the science developed in Renaissance, more and more scientists and physicians appreciated that it's actually your brain that controls your thoughts, and it's your brain that when it's not working well makes you have dementia. And actually one well-known scientist, physician, Dr. Willis, established that memory loss could be because of too much alcohol, infections in the brain, medical diseases, or it could be an inevitable part of aging. So he had actually a differential diagnosis. In the 18th century, things changed. There were a lot of young people who had syphilis, and they would act confused and they had unusual behavior. So people thought that old people who act confused and their behavior is different must have had syphilis when they were younger. So they were looked at as bad people who had syphilis when they were younger, and this was their punishment. Can't imagine how they felt. Things changed dramatically in the 19th century. Dr. Alzheimer's was a pathologist. Actually, he was a forensic pathologist and a clinician. He had two friends in Germany. One was Dr. Nissel, who was very good about cutting brain and looking at different stains to see what the brain cells look like. And he had another friend, Dr. Zeiss, who had developed microscope. And then with the help of his friends, he would be able to cut people's brain, stain them, and look under microscope. And he loved doing that to figure out what conditions cause what diseases. And I had one peculiar patient. It was a lady in her 50s who had become demented, and Dr. Alzheimer's followed her, monitored her for a few years, and when she died, he looked at her brain and noticed that there was this clumps of proteins. Some that were between neurons and some were inside neurons, and he called them plaques and tangles. And he appreciated that this was a peculiar case because usually these things don't happen. He knew that when people get older, the reason they become dementia has to do with how much stroke they had and whether there were concussions or other things. He made a distinction between early onset dementia, when people have memory problem, confusion in their 50s and 60s, versus late onset dementia. And the fact that the late onset dementia was a mixed bag of a lot of things, especially vascular problems, strokes. He called it a strangulation of blood vessels causing dementia. He was very clear that these plaques and tangles have nothing to do with late life or late onset dementia. But what happened was his boss was a chairman of the department at the time, and there was competition between Germany and Prague universities, and he wanted to have something up on them, and he was writing a book, and he decided to include the story of what Dr. Alzheimer's had described about this particular case as to Alzheimer's disease. So he labeled this unusual, uncommon patient as having Alzheimer's disease so that his colleagues elsewhere in Europe would envy and come to Germany to study in their university. Now, as time passed in 1930s and 1940s, more and more people felt that late life dementia is senile dementia. It has to do with hardening of the arteries. In fact, a lot of times dementia was called hardening the arteries. And interestingly, drugs that would cause dilation of blood vessels became the bestseller in the United States. So everybody was convinced that the reason you become demented in late life has to do with hardening the arteries and less blood flow to the brain. Well, things changed in 1980s. There was a huge discovery. Scientists looked at these plaques, they took them out from under a microscope, they dissolved them, and they determined what constitute those plaques is a protein called amyloid. This was really exciting because they felt like only if they can find a way to dissolve these amyloid plaques, they cure Alzheimer's disease. And the emphasis changed from senile dementia to senile dementia of Alzheimer's disease, and then it became senile dementia of Alzheimer's, and then it later on just became Alzheimer's. And more emphasis was put on these plaques, amyloid plaques, and discovery of drugs that would dissolve the amyloid. So much so that they decided to call any memory loss as early stages of Alzheimer's disease, because Alzheimer's had to do with amyloid. If you figure out amyloid, you can cure any memory loss and Alzheimer's disease. And of course, this was not the case because other scientists, other researchers showed that many factors contribute to the brain shrinkage that happens in late life, which then leads to dementia. The late onset dementia, as Dr. Alzheimer put it, was a mixed bag of a lot of things: obesity, alcohol, lack of sleep, heart disease, and so on. And so what we have come to realize is that as much as there's an excitement for figuring out how to dissolve amyloid and cure the disease, there's also realization that many factors can contribute to smaller brain and dementia. These include things like diabetes, obesity, sleep disorders, alcohol, and if you're young and develop the problems, Alzheimer's genes. But Alzheimer's genes really are a main factor on young people, 50s and 60s. Late onset is a mixed bag of things. On a positive note, we've discovered that many things can actually literally grow your brain. These include exercise, learning new things, meditation, taking supplements like DHA, and having a healthy diet. These things can literally grow your brain and reduce your risk of Alzheimer's disease. So I can just picture Dr. Alzheimer saying, "Das ist falsch. This is wrong. What are you doing calling people in their 80s and 90s having Alzheimer's disease?" They don't have Alzheimer's disease. They have a mixed bag of a lot of different things. And that is good news. It means that your lifestyle factors affect your brain, and since you have the choice and you have the ability to modify your lifestyles, you can be proactive in reducing your risk of developing memory loss and dementia later in life. So in summary, if you have memory problems, don't even think about Alzheimer's disease. Dr. Alzheimer himself would tell you, "Das ist falsch." Don't do that. Focus on exercising, eating well, reducing stress, sleeping well, and these will help you have a sharper brain when you get older.